Hi everyone, I'm Dr. Megan Dowling and thanks for tuning in to this week's Healthy Families live video series. I hope you enjoyed last week's video when I shared my 2 personal birth experiences. And I mentioned in that video that I enjoyed the benefits of a doula-supported birth with the birth of my son, and she helped me realize the goal of an unmedicated VBAC. So today I wanted to talk to you about what the research says about doula-supported births and how you can find one to connect with in your area. So according to DONA, which is an international doula certification and training program, a doula is a trained individual who provides physical, emotional, and informational support to a woman before, during, and even immediately after childbirth in order to help her achieve the healthiest and most satisfying birth experience possible. So I think that's a beautiful definition. I mean, what woman wouldn't want that? So the way that we treat birth in our culture is that we truly kind of treat it as a disease. We medicalize the pregnancy and birth experience in many ways, such as even just having babies in hospitals. I actually have a patient, she's from the Netherlands, and I asked her where she was going to give birth, what hospital she was going to give birth at, and she looked at me like I had 2 heads, and she said, "I'm having my baby at home where they're supposed to be born." So in her culture, hospitals are where you go for when you're sick or injured. They're not to have babies in. So this is why doulas are especially important in our culture, because they can recognize what is normal about the birthing process and can be another voice or opinion for us in the delivery room if a doctor wants to do another intervention. So many studies in several different countries have been conducted comparing the usual care with the usual care plus continuous support from doulas. And the largest systematic review of continuous labor support, so doula-supported births, contained 21 randomized controlled trials, which are the gold standard in research, and they included 15,000 women, which is a huge sample size. And these studies found that women are 28% less likely to have a C-section, 12% more likely to have a spontaneous vaginal birth, 31% less likely to use synthetic oxytocin or Pitocin to speed up labor. They are 9% less likely to use any pain medication, 34% less likely to rate their childbirth experience negatively, and they saw a 14% decrease in newborns being admitted to special care nurseries, so like the NICU. So with evidence-based numbers like these, it truly blows my mind as to why doulas aren't the standard of care at all births, especially if you want to talk about saving money. If we know that doulas decrease C-section rates by 1/3, and each C-section costs insurers $20,000, then it's pretty easy to see the cost-saving benefits there. And why doulas aren't covered by insurance is a mystery to me. But the emotional side of experiencing a doula's care is the priceless component. So how do you find a doula that you feel can best support you during this special time? A great resource that we have in this area is called BABI. It's BABI, and it stands for Bay Area Birth Information. This is how I found my amazing doula, who, if you are curious, her name is Caitlin Clark, and she is at Full Moon Birth Center in Santa Cruz. So another amazing way to meet a doula is to go to these Meet the Doula events. They're held across the Bay Area. You can find one by just typing in Meet the Doula and then your city, and an event will pop up. And these are really great events because they can answer many doula-related questions that you have, and it's really important because you can speak directly face-to-face to many of the doulas there. So it's a great way to interview and find a doula that you connect with. So anyway, if you know somebody who is pregnant and maybe considering a doula, please consider sharing this video so they can learn more benefits about a doula-supported birth. And if you have any questions, as always, post them in the comments section below this video, and I'll be happy to address them. So I'll see you next week with another super interesting Healthy Families topic. Bye.